I wanted to say that I'm so happy you came in. I know that it's been 8 years since you've been to the dentist from a lack of insurance. I'm excited to start treatment to help improve the health of your oral cavity because you really need the treatment. After conducting your oral assessment today, there were a few areas of concern that I wanted to bring to your attention.
What are they? Is everything okay with my mouth?
I wanted to start off with talking about your gingival assessment, meaning the health of your gums. I noticed that you have visible, generalized, meaning that it's all over your mouth, erythemic, red, and inflamed tissue. There was bleeding present throughout your entire mouth. As you can see in this picture of a healthy oral cavity, you can tell that it differs from yours in the mirror. So I'm going to hold up the mirror so that you can tell the difference. Can you see that your gum tissue is more red and inflamed than the picture that's healthy?
I can.
Great.
Why is it important though?
It's important because this confirms that you have signs of gingivitis. This is a really big concern because red inflamed gums means that the bad bacteria and disease are present in your mouth. Think of when you get a cut on your arm or leg, and this cut becomes infected. It too will result in red and swollen tissue as a result of the infection in your body. I know that you said your gums hurt and bleed when you brush, so you don't do it very often. The reason that your gums hurt and bleed when you brush is because these bad bacteria are present in your mouth from a lack of good oral hygiene care. This causes your gums to be more sensitive and bleed as a result of the increased white blood cells at the site of the infection.
So this sounds bad. Is there any way to improve the health of my gums?
Yes, of course there are. During your assessment, I also noticed that you have a significant amount of hardened plaque buildup called calculus. This means this needs to be professionally removed, but once the calculus is removed, the bacteria that it harbors will also be removed, and it will help significantly improve the health of your oral tissue. Also, improving your at-home care will help maintain the health of your oral cavity by helping your body reduce the presence of bad bacteria, increase the presence of healthy bacteria. I know you said you brush one time daily. It's very important that we increase this to 2 times daily by your next appointment. Going to bed or spending the day with bad bacteria in your mouth is breeding grounds for many dental infections. Using mouth rinse and antibacterial mouth rinse such as Scope or Listerine Total Care help reduce bad bacteria significantly as well. I could even write you a prescription mouth rinse called chlorhexidine if you would like. This would help reduce your risk for caries and gingival infections if used properly.
Will this prescribed mouth rinse help get rid of my decay?
Tooth decay needs to be removed and diagnosed and replaced with other materials by the dentist, but it will slow the progression of the decay and even help prevent new decay from spreading. You're currently at risk for decay because you have 6 teeth with areas of decay on them. Does that make sense?
Yeah, so you're saying that this mouth rinse is not going to get rid of the decay, but it's going to slow the process of the progression?
Yes. I can also tell that you're clenching and grinding your teeth because you have generalized attrition on the maxillary and mandibular arches. This means that I can visibly see that your teeth are being worn down from the trauma of you grinding your teeth on both the upper and lower arches of your mouth. You also have a white line on the inside of your cheek called linea alba from biting your cheeks. And also the starting effects of recession on teeth number 21 and 27. This can be dramatically improved by buying and using an over-the-counter night guard at night while sleeping or during the day when you feel yourself grinding your teeth. Do you have any questions about how to get a mouth guard?
No, I used to have one, but I lost it. I didn't know it was that important, so I'll definitely be going to go get a new one.
Another thing I wanted to talk to you about was your blood pressure. The vast number of bad bacteria in your mouth could be playing a role in your overall health. Controlling the bacteria could aid in benefiting your health over your overall body and including your heart. I think that you need to go back to your doctor and ask for recommendations on how to control your blood pressure more effectively, as it was significantly higher than the healthy reading.
Yeah, I didn't know that your oral health could affect your overall health, but yeah, I'll definitely be sure to let them know.
The final thing that I wanted to talk to you about was your smokeless tobacco usage and the effects that it is having on your mouth. I can see from the questionnaire that you rub 2 cans of snuff a day, which means that you are an avid tobacco user. And as you know, this increases your chance of oral cancer. I also collected that you drink more than 2 alcoholic beverages daily and several drinks on the weekends. I wanted to let you know that drinking and using tobacco products simultaneously increases your chances of getting oral cancer by more than 60%. In your take-home bag, I have listed the effects of oral cancer and the 1-800 numbers for quit lines if you're interested in quitting.
I'm not really interested in quitting, and I don't really want to talk about the subject of quitting. I just also don't want you guys to ask me at the next couple appointments either.
Well, I understand your frustration with the pressure to quit. I am legally accountable to inform you about the effects. You also have a leukoplakic white area in the mandibular left vestibule right here on your lip. The lesion is associated with tobacco use and needs to be checked by the dentist to ensure that it does not need biopsied and check to see if it has cancerous cells in it. If you ever decide that you want to quit, please be sure to let the clinic know so that we can assist you in quitting. But we will no longer be asking you questions about quitting because you have stated that you no longer want to be asked.
So what treatment will we be doing today?
Today, I recommend the procedures of scaling and root planning. This means that we will be removing your calculus. It is important in improving your oral health. If you do not have this done today, then we will not be able to assist you in improving your oral health. If you do proceed with this treatment today, we will begin taking the steps towards improving your health today. The disadvantages of this treatment include possibly having sore gums for the next few days. Risk and side effects for this procedure include possible temporary increase in tooth and gum sensitivity. The treatment will take a course of 8 weeks to complete the debridement. Following that, we will be doing a polishing treatment. Upon completion, you will come in every 3 months to maintain your oral health. If you complete this treatment, you can expect that your oral health will improve and you'll have less bleeding and pain when brushing.
Sounds great. I'd like to go forward with the treatment today and also on the paper saying that I understand and consent to everything.
Okay, awesome. If you could just sign right here. Great.